Knife crime is a serious problem, and one of the most immediate dangers of this type of violence is the risk of bleeding. When a person is stabbed or cut with a knife, it can cause significant bleeding that can quickly become life-threatening. The severity of bleeding caused by knife crime can vary depending on the location and depth of the wound. In some cases, the bleeding may be slow and steady, while other cases it may be rapid and profuse. The wound may also appear to be jagged and irregular, may be accompanied by other signs of injury such as swelling, bruising, or tenderness. Depending on the severity of the injury, it can cause a range of complications including shock, organ failure, and even death. It's important to seek medical attention immediately if you or someone has been injured in this way. Some of the medical dangers associated with bleeding caused by knife crime include significant blood loss, which can lead to shock, which causes the body's organs to shut down. In severe cases, it can be fatal. The risk of infection is high with knife wounds, particularly if the knife penetration is deep as it penetrates the skin. Infection can cause a range of complications including sepsis, which is a life-threatening condition. Knife wounds can cause damage to nerves and blood vessels, which can lead to numbness, weakness, and other complications. And finally, being the victim of knife crime can also cause psychological trauma, including anxiety, depression, and post-traumatic stress disorder. If you or someone else has been injured by knife crime, it's important to seek medical attention immediately. The priority will be to stop bleeding, which may involve applying direct pressure to the wound, using dressings, applying a hemostatic dressing, or if on a limb, applying a tourniquet. The wound will then need to be cleaned and dressed, and in some cases surgery may be required to repair the damage. In addition to the medical treatment, it's also important to seek support for any psychological trauma that may result from the injury for the patient and the first aiders. This may include counselling or therapy to manage the symptoms of anxiety, depression, or post-traumatic stress disorder.